Hi there, and good morning. My name is Mike Clazel, and I am mayor of the small town of Kaplan, Louisiana. Today is my first day of self-imposed quarantine. I am quarantined because I am following all of the same guidelines that I expect all of the city employees to follow. I have been exposed to someone that tested positive for COVID-19, so therefore I am self-imposed quarantine. I myself have been tested. I tested late yesterday afternoon, and I tested negative. However, since I have been exposed, I am staying away from City Hall for a few days, and I'm going to chronicle my quarantine throughout this whole endeavor, however long it may be. Hopefully it's just a few days and I'm able to get back to work. I will be working from home. I've taken phone calls this morning. I've gone about my business as if I were there without actually being there. We had our IT guy, Comtech, out of Lafayette, Louisiana. They do a wonderful job. Comtech hooked my laptop up to where I can work from my office computer just as if I was sitting in front of my desk. So that helps. We do have a COVID-19 update today at 11 o'clock that I plan on sitting in on and being a part of. So as of now, I really don't have anything to report. It's been a pretty uneventful morning. I did everything that I normally do in the morning. I got up, I did fix me some breakfast, which I usually don't do on a weekday. I had my shower, I shaved, I wanted to go to work. Man, I can tell you, retirement's just not really in my near future. This is going to drive me batty. I am at home with the dogs. You probably hear Gracie barking in the background every time a car passes by her window. She is offended by that, and she does let everybody know that she is offended by that. So you will probably hear her throughout the next day or two, or however long we give these updates. But that's where I'm at right now. I feel great. I will do another update this afternoon. I'll let you know what I learned during my COVID-19 update from Dr. Tina Stefanski, who is our regional director for the Louisiana Department of Health. So with that said, for right now, that's all I have. I'll be back later. All right, so this is day one, part two of my personal quarantine. Self-imposed, I might add. I've got one more day for sure, and then the weekend, and we'll see where we're at on Monday with regards to going back to work. Still feeling fine, no problems at all. Like I said earlier, I did test negative on my test. I will test again tonight or in the morning, not sure which one, and I'll report that back as well. But for right now, I feel normal. I feel fine. Don't have any problems. Again, I am fully vaccinated, so hopefully that helps if there's any problems. I did attend the briefing today that LDH holds every Thursday in our region, and I'm going to go over some of the things that I learned today on it. Right now, expectedly, I'm sure you're not going to be surprised by any of the information that I give, but right now we have the highest level of COVID hospitalizations in our regions since the beginning of COVID, period. 9 out of the 10 people in the hospitals are unvaccinated people. There have not been any deaths reported in our region of fully vaccinated people as of yet. If you are fully vaccinated and test negative through a certified testing site, you do not have to quarantine even if you have been exposed to someone that is positive. Now that's if you're fully vaccinated. The home test kits do not count on this because they are designed for fully symptomatic people and will show a negative in the early stages of having COVID. So you need to get tested by a certified COVID testing site, medical site, rather than home site. So in order to know whether or not you really are negative. If you have not been vaccinated, you should quarantine for at least 8 to 10 days if you have been around someone that is test positive. Now, when we say being around someone that tests positive, that means that you're within a 6-foot area of that person for approximately 15 minutes or longer. So that's what they mean by that. Not only right now are the hospitals at full capacity, but they are shorthanded because even their employees are catching COVID from new admits, and hospitals and doctors are also losing nurses to other areas of the country that can afford to pay them more money, and they are going for that. This is soon to be a healthcare shortage in our region if this trend continues. Also learned today something I thought was just the opposite. Even if you have the vaccine and you do catch COVID, because there is that chance that you'll catch it, you are still eligible for the infusion under most circumstances, but it must be given within 10 days. I've really gone about my business pretty much today as if I had been in the office, because I've been on the phone. It's been one phone call after another since early morning. There's always something going on that needs to be handled. So that hasn't really stopped. It's been a busy day. I don't like being at home. I don't like being told you have to stay in this area. That's really not for me. But nevertheless, I'm going to do it. I've got another few days before I feel like I'm safe. Even though LDH says that I could go to work as long as I test negative through a certified testing site, I'm still going to do it. See what just to be safe. Honestly, my thoughts are right now, I don't believe that I contracted COVID. I feel normal. I know that can change probably at any given time, but for right now, I feel normal. Great. As great as you can feel when you're 64 and old and run down. I feel good. I don't think I'm going to film any more today. If I take the test tonight, I'll give the update tomorrow. If I take it in the morning, we'll see what happens. But right now, I feel good, so knock on wood, I feel fine.